I often thought and speak and sometimes write about what I call the barriers to driving excellence in patients with overactive bladder. I think the number one barrier actually in today's healthcare system is apathy. I think we're running so fast and the pressure we're under, we're just trying to survive. But I think if we can slow down and say, look, I'm going to drive excellence, I'm going to deliver the best care I can, that sort of sets the starting point of anything that's below that pyramid in a sense that will support that theme, like PTNS or physical therapy or fighting for the copay of a medication. It's because you believe the excellence is important. It fights the apathy. I think a lot of physicians don't realize it's actually not the outlet, it's the bladder. It's not the prostate, it's the bladder. They don't need a sling for their mixed incontinence stress, it's more of a bladder problem. The more you listen to the history, you hear the overactive bladder components and the goal of the patient, and you do a lot of urodynamics, you're going to be treating the bladder more than the outlet in many cases, which will go down a pathway to neuromodulation treatments. I think a third is what pathway, or what algorithm, I used to say. And now the OAB pathways are quite popular. But at one point in time, we weren't driving excellence because they were just sort of saying, try this, as opposed to saying, Mrs. Smith, I've seen you for the first time, and you dictate early your pathway. So you have this plan of attack, and hopefully you can reach a treatment goal somewhere along it. And I think another one, I'll sort of leave it at this, is I would call the no thank you dears. It's all the elderly patients, or maybe their symptoms are milder, or they have a lot of medical comorbidities, and you go through 3 third-line therapies, and they kind of feel a little bit overwhelmed, even though you're trying to spend time with them. They say, no thanks, I'll just live with it. And I think if you introduce the treatments and the pathway to them, for instance with handouts early, they're more apt when you sort of overwhelm them in a sense in that longer talk to make a better patient, a personal choice. Do they really want to pursue further treatments?